Dr. Tim Nicholl, Clinic Director here at Maximize Chiropractic. I serve a lot of members in the community who sit for prolonged periods of time, and the news is catching on that sitting is really the new smoking in our public, in our community, and people are seeing that this really has some irreversible effects on the health. Now, what's important is not the injury such as sitting. Sitting is just creating a large number of injured people, but it's why our bodies aren't adapting to the environment that we're placing ourselves in. If you think about it, whether I sit, whether I stand, while I jump a lot, any prolonged activity done the wrong way will affect your health negatively in the future. So what we are aware is that sitting usually causes more of that forward posture. And as my posture sits like this, not only do I not get oxygen through my lungs, not only are some of the digestive organs compromised from that forward posture, but also it affects the actual spine and the nerves that therefore control organs, muscles, and tissues inside. So in all reality, until robots are doing our jobs, you're going to have to sit, or if you'd like to, you can stand. But regardless, you're still going to have to deal with the effects of prolonged posture and the effects of gravity. Now, what's important is not the injury. If you look at this x-ray right here, this is what I deal with in a clinical stance. When we look at an x-ray right here, you're going to see that instead of the body having a normal C-shaped position, what happens is that prolonged sitting causes the body to shift forward. And as the body shifts forward, pressure is placed on the front of the joints, and over time, such as you'll see right here, you're going to see degeneration and arthritis being placed in these joints. Now, degeneration such as this does not happen while sitting for 1 or 2 years. It's years after years after years of doing a prolonged activity and only going to doctors in the time of a crisis. There's an important way to see if sitting is affecting you, because some people get away with it, other people don't. The first thing to look at with your posture is, especially for women, do you have a hump on the back of your neck? For women who sit and sit long periods, they start to lose this curve in the neck, and their spine starts to open up at the base of the shoulders. That's where you'll see, and you might see Aunt Marge or other people with that large hump on their back. And that hump is caused by inflammation in the joints. And inside the neck, what happens is instead of having this C-shaped curve, the spine goes into the opposite direction. This not only causes the swelling and the hump on the back, but what happens long term is it causes degeneration of the joints, which puts prolonged pressure on the spinal cord and the nerves, which then cause the brain to no longer communicate with the organs, muscles, and tissues, which then lead you to going to your doctor, put you on medication to treat the symptom, while the cause of the problem is still there. So the moral of this is that if you are doing any repetitive activity, don't fear it because it's repetitive. Learn how to get your body into that adaptive exposure and how to adapt to a stressful environment. Chiropractic is one of the only hands-on therapies that allows the spine to move into a proper position. If I'm like this 7 days a week, I need to stand like this as much as possible. The chiropractic adjustment, if assessed properly through motion x-rays of the spine, through corrective exercises, and through the proper reassessment, you can fully strengthen your spine to adapt to a sitting process so that your work doesn't end up killing you in the future.